What's up, nerds? I've got Shervin Aazami from the 30th District of California, who's running for U.S. Congress. He is tired of corporate Democrats. We're gonna talk about what that means and what he's up to. But before we do that, let's warm it up with Andrew.
Yo, there's no place to hide now that he's arrived. I'm saying he ain't playing now with this campaign. Bang, dang, it's in. Drew, come roll with the Yang Gang. Drew Yang Gang, that's who I hooked up with. Drew Yang Gang, that's who I hooked up with. Drew Yang Gang, that's who I hooked up. Yo, there's no place to hide now that he's arrived. I'm saying he ain't playing now with this campaign. Bang, dang, it's in. Drew, come roll with the Yang Gang.
Hello, nerds.
Hello, nerds.
Welcome, Shervin. How you doing, buddy?
Doing well. How about you, Tom? Thank you so much for having me. Thank you to your viewers.
Yeah, no, I'm excited to learn more about you. I think I discovered you on Twitter, and then I saw your profile on Of the People, which is of course the nonprofit that I co-founded and wanted to get you into the nerd zone to learn more about yourself. Why don't we kind of start off with who's Shervin? Like, what's your background before running for Congress?
Yeah, of course. Again, thank you so much for having me. My name is Shervin Aazami. I'm a father, I'm a husband, I'm a public health activist, community organizer, and immigrant, running for U.S. Congress in my hometown, West San Fernando Valley, California's 30th District. I am the son of two Iranian asylum seekers who fled religious persecution in Iran during the time of the revolution back in 1979, with nothing but the clothes on their backs, to Italy. I was born there, and then we emigrated to the Valley when I was an infant. My mother worked in retail for pretty much my entire youth, while my father went back to school to become a primary care physician. And I always say I learned the power of responsibility from my mother and the power of service from my father. And, growing up as a son of a primary care physician, growing up in a healthcare environment, I've always been fighting for social justice through the lens of public health, kind of taking a more macro systems level view around why are so many people in our communities suffering from food insecurity, from homelessness, from lack of living wages and basic income, lack of clean air and water, and how all of these issues are intersectional and work collectively to impact our population health outcomes, our economy, our national security, and everything in between. And so someone who's worked on the programmatic side of public health and the policy side, on the programmatic side, working with and for the community to design programs to address a whole slew of issues, everything from chronic diseases in our communities to addressing the toxic health impacts of urban runoff in our local communities of color, to working with high school youth to improve access to health education, healthcare services, STI screening, and so forth. And, throughout all that work, there are always barriers in the types of programs we can implement. And those barriers were never because of what the community wanted, but because of policies in place designed by individuals, elected officials, who were out of touch with what was happening on the ground. And so by recognizing those barriers and facing them over and over again, I started delving more into policy. I've ended up working in Washington, D.C. as the legislative director for the National Indian Health Board, which is the only national indigenous healthcare nonprofit fighting to make sure the federal government honors its treaty obligations to tribal nations. And, we were doing that work during the height of COVID-19, with Native peoples being disproportionately impacted by death rates, infection rates, hospitalization rates. And through our advocacy, we were able to get over $10 billion in direct funding to tribes to respond to the COVID-19 crisis. Believe it or not, the first time in U.S. history that during a pandemic, our federal government provided direct aid to Native peoples. Even during H1N1 under Obama and the Spanish flu pandemic a century prior, even though Native peoples had death rates 4 times the general population, the U.S. government sent tribes body bags as opposed to vaccines, testing kits, and resources. One of the bills I'm most proud of getting across the finish line is a bill that canceled copays and deductibles for Native American veterans, getting us one step closer to passage of single-payer Medicare for all, which is one of our top priorities for our campaign. But, again and again, throughout that work at the national level, I tried to work with the incumbent, tried to appeal to him as someone who grew up in his district. And he was someone who was a member of a lot of the important committees and caucuses that we worked with. Yet again and again, I would either receive no response or the most perfunctory response imaginable. And we'll get into more of why that is in a little bit. But for me, looking back in our district and all the issues in our communities, I believe we deserve a bold, progressive advocate who's going to put in the work each and every single day to achieve the transformative structural reforms that our communities need. There is zero reason beyond political cowardice, institutional racism, and corporate greed that the wealthiest nation in the history of the world cannot guarantee healthcare, housing, clean air and water, living wages, basic income, education, and union rights for all as inherent human rights. And that's really what our campaign is all about.
So this incumbent has been in elected office since the late 90s, it looks like. And he's done pretty well in the last one. You're definitely swimming upstream. Tell me a little bit about why you think 2022 is going to be any different.
Because I think we've seen how much our community has changed over the past several years. I think one, with the reckoning of the Trump election in 2016 and all of the issues our country has faced for decades and decades, but also precipitated over the past couple of years. I mean, we are coming out of the wake of the worst public health crisis in U.S. history, with millions of people losing their jobs, losing their wages, losing their employer-sponsored health care, on the verge of eviction. Yet we continue to see our politicians tinker around the edges with incremental changes. As millions of people lost their jobs, our country minted 44 new billionaires. Right now, during this pandemic, 719 people entrenched their wealth by 1.6 trillion, while the bottom half of America is deciding between paying for rent or paying for food security. And these issues are happening in our communities. Los Angeles is ground zero for our housing and homelessness crisis. We have 5 unhoused neighbors die per day in our city. More unhoused folks in LA die of hypothermia than in San Francisco and New York City combined. In sunny LA, more folks are dying of hypothermia. We continue to see the city and the state invest more and more money in criminalization of homelessness, criminalization of poverty, as opposed to investing in permanent supportive housing, investing in basic income, living wages, and so forth. And at the same time, we are dealing with a housing crisis where now, here in our district, the median single-family home is just under $1 million. How do you afford that if you're making minimum wage? If you're a nurse, if you're a teacher, if you're a sanitation worker, if you're a grocery worker, how do you afford to be able to buy a home and increase your generational wealth? At the same time, here in California, over a third of our state's 3.4 million uninsured reside here in LA. LA also has the worst ozone pollution in the country. And our district is ground zero for our climate crisis. The largest natural gas blowout in U.S. history happened in our district back in 2015 at a site called Aliso Canyon, where over 109,000 metric tons of methane were dumped into the air, alongside many other carcinogenic substances that we still don't even know are out there because the health department has put the kibosh on releasing it to the public. Yet we've seen no real efforts from the incumbent to push us towards remediation and cleanup. And again, these issues that are impacting our communities have fallen by the wayside. And our district is very, very progressive. We are a D+18 district that Bernie Sanders won handily during the presidential primary. Our district also voted to oust a district attorney that was fighting against an end to mass incarceration. Our district also voted for a county measure to reduce the funding of the sheriff's department and redirect those dollars into education, into housing, into clean air and water and other social services. So we are very, very progressive, but we've been stuck with the same corporate representation since day one. Someone who has never championed any progressive bills to address the issues in our communities. Living wages to housing, to basic income, to climate justice, immigration reform, and everything in between. In fact, he's one of the biggest war hawks we have in Congress. And as someone who's a son of asylum seekers, these issues are really, really personal for me. You know, LA is the home of the largest Iranian population outside of Iran, lovingly referred to as Tehrangelis. Yet our incumbent was the only Democrat to speak at a rally in 2019 hosted by a group called the MEK, which is an Iranian militant separatist group that were a designated terrorist organization until 2012. And so he's pro-imperialist, he's pro-militant regime change, and he was the only Democrat to speak at that rally alongside John Bolton, Rudy Giuliani, and Mike Pompeo, some of the most hawkish neocons we have working in foreign policy today. And, you know, so all these issues are coalescing. I'm thinking to myself, you know, our communities are suffering. We have people standing, waiting for their health care, waiting for their food security, and lines stretching for miles to in food banks. Our campaign is doing mutual aid every single Sunday, working with our unhoused community, providing food, tarps, tents, harm reduction supplies. So many issues in our community, so many people suffering, yet we've seen absent leadership again and again and again. And especially when it comes to housing and homelessness, this is where I feel like the incumbent has failed most drastically, because he actually chairs the very subcommittee with jurisdiction over our federal housing finance laws. And as soon as he became chair of that subcommittee, BlackRock and Blackstone, the two Wall Street corporate landlords that have been responsible for defying the eviction moratorium nationally, and have been buying up homes, single-family homes all across the entire country, buying up apartment complexes all across the entire country, and artificially keeping supply low while increasing demand, leading to skyrocketing costs. Those corporate landlords started bankrolling his reelection campaign. And we haven't seen him introduce a single bill to address housing affordability, to eradicate homelessness. And again and again and again, I firmly believe budgets reflect priorities. In the wealthiest nation in the history of the world, poverty is a policy choice. I'm happy to get further into that, but that's really kind of what we're seeing happen in our communities. And it's the recurring failures of the incumbent to step up and be the bold advocate we need him to be that really kind of galvanized our community and said, enough is enough. We need new leadership.
You talked about poverty and a little bit about alluded to basic income. Mm-hmm. It's been interesting, obviously, for viewers of this channel, since we started out really as a Andrew Yang for President channel.
Right.
It's become more talked about. I actually just stumbled upon HR 4895, which is sponsored by Ilhan Omar to direct the Secretary of Treasury to establish a federal office to oversee local guaranteed income pilots. I mean, who would have thought that that would have even have been a possibility, you know, a year ago? Yeah. What's your take on basic income? Like, are you supportive? And if so, absolutely. Like, what are your thoughts on whether it would be like how it should be funded and how it should be allocated, and just a little more of your thinking about it?
Yeah, and I'm so happy you asked, because I've actually evolved on this issue. You know, when we first launched our campaign, our platform included basic income, but it was only for individuals making up to $150,000 a year and households making up to $300,000 a year. So that covered 97% of households across the entire country. But as I chatted with advocates within Yang Gang, as I chatted with experts on basic income, they really opened my eyes to the importance of real universality in these programs. And I'm someone who fully supports universality. I'm a staunch supporter of single-payer Medicare for all, of housing for all as an inherent human right, of canceling student debt, a free public college and university for all Americans. And so as folks kind of opened my eyes and gave me some more tools and resources to understand why UBI, we needed the U in UBI, it really opened my eyes. And at first, I had kind of this knee-jerk reaction that a lot of folks, to be quite honest, on the progressive left have, which is that we don't want to give basic income to millionaires and billionaires. Elon Musk shouldn't be getting an extra $1,000 a month in taxpayer benefits. We shouldn't be bailing out, Jeff Bezos and others. And, I am vehemently against corporate bailouts. But, I definitely understood the importance of universality, because means testing does not help working people. And when we create these bureaucratic layers, we impose this red tape, it inherently harms the people who need these resources most. And so I really appreciate that education from folks within the Yang Gang, as it helped us kind of update our program. And we put out this long thread on Twitter a few months ago explaining why we made the change. And now I am fully on board with truly universal basic income. And so seeing, and to kind of talk more about this too, like I've been familiar with basic income for many years because a lot of tribal governments actually have a form of basic income. They call it per capita payments, but it's essentially the same thing. Over 100 tribal nations across the country have a form of basic income. And some of them means tested, some of them don't. These are sovereign nations. Each sovereign nation has their own policy on this. Some tribes will say, as soon as you're 18, we'll provide a lump sum annual payment. For other tribes, it's a monthly payment. For some tribes, they're required to get a college degree first. So it kind of varies. But these were examples of basic income that I was familiar with. But I really give a lot of credit to Andrew Yang for popularizing UBI on the national scale during his presidential campaign. Because I think what we saw in these stimulus packages that Congress passed, providing those $1,400 checks, what we saw the Biden administration do with this child tax credit on the American Rescue Plan, I definitely give a lot of credit to Andrew for popularizing this and really making it a part of our national political discourse around how we bail out middle and working class families. And so getting to the topic of the Support Act in particular, I read this great piece from Max Jennis and others at UBI Center about the bill. It really is the closest thing to universal basic income we've seen at the national level. It is still means tested. It does provide some smaller payments based on your income level. And to your, as you mentioned, Tom, it kind of pilots the program with full implementation by 2028. So I think there are some very valid critiques of the bill out there around, how do we actually make it universal? Why are we kind of delaying implementation so many years? But I'm a supporter because, again, it really ignites the national conversation around UBI. It's the closest thing we've seen, and our campaign tweeted out in support of it, because I think what's really critical about it too, and what's really smart about the bill, is that it combines basic income with public banking. Two issues that I really believe are very intersectional. I mean, here in LA, roughly 7% of Angelenos are unbanked. And this is a huge racial justice issue, because when you break it down by communities, our Latinx Angelenos, their rates of being unbanked are more than double the city rate. So this is a huge, huge area for us to address and make sure that people have that financial stability. So I'm a supporter of the bill. Again, I think there are valid critiques, areas of improvement, but it's the closest we've come at the national level for a truly universal basic income. And I think it's important to start that conversation and get the ball rolling and get it implemented.
Yeah, I have been really impressed with Omar going far, pushing this to the forefront. And, she's sort of becoming a UBI champion in Congress, which is great to see.
Yeah.
And I'm so glad that, obviously Andrew got this ball rolling at the national level in a way that, before he ran for president, nobody was really talking about it, except for just some kind of corners of academia and stuff.
Right.
Tell me a little bit more, Shervin, about what would be your top priorities if you got into office? Like, what would you sink your teeth into first?
So if it boils down to three areas: climate, housing, and foreign policy. I'll tell you why. I mean, the report that we saw this past week from the Intergovernmental Panel on Climate Change put the situation in no unstark terms. We are barreling towards a climate catastrophe. Many of the worst impacts of climate change are already here, and they are irreversible. From raging wildfires, which California and Southern California in particular are very, very vulnerable to. Droughts, again, a huge issue for Californians. Rising sea levels, melting permafrost, severe storms. These issues are only going to get worse as we continue down this road. And when I say climate change is intersectional, this impacts so many other areas of policy, from healthcare to immigration, to our economy, to foreign policy. Climate change has a hand in each and every single one of these areas. Let's talk about healthcare as one example, where right now we are seeing low-income Black and brown and indigenous neighborhoods being on the front lines of our climate crisis. And we need to make massive investments to immediately transition to a 100% renewable energy economy and abolish our reliance on fossil fuels. Again, it was in the starkest terms. We have to engage in these transformative changes to our economy and where our energy sources are derived in order for us to be able to maintain global temperatures at only 1.5 degrees Celsius above pre-industrial levels. We have to do that to avoid catastrophic change and make sure we have a livable planet for the next 7 generations. And, you know, as a new father with a 9-week-old child, you know, I keep thinking to myself, all of our scientists are telling us we have to have a 100% renewable energy economy by 2030. He's only going to be 9 years old. And I keep thinking to myself, what world am I leaving my child? What world am I leaving my neighbor's child, our community's children? We have to address this issue as the existential crisis that it is and really initiate a war on climate change and make these necessary investments. And this is so tied to foreign policy and our military industrial complex in general, in particular, because the U.S. military is a greater global emitter of greenhouse gases than over 100 countries combined. Our military consumes over 719,000 barrels of oil per day, and that was back in 2017. And again, I mentioned earlier, budgets reflect priorities. Well, what we're seeing now is we have a $740 billion enacted military budget, which is, by the way, 43% of our annual discretionary budget. 43% going towards the military. For housing, it's 2% of our annual budget. Education is about 4%. So this demonstrates again that we are not putting money in the hands of the people, in the hands of the communities. Instead, the money is going towards endless wars and lining the pockets of weapons manufacturers. Now, we saw Congress for fiscal year 2022, as they're working on that budget, propose an increase to $778 billion. With that amount of money, we could enact a Green New Deal for cities and states, a Green New Deal for public housing, a Green New Deal for public schools, a fully funded civilian climate corps, which would mobilize 1.5 million youth in living wage union-backed jobs in conservation, public health, cleanup of Superfund sites, climate mitigation and adaptation. We could accomplish all of this and still only account for about 60% of the military budget for 1 year. We could enact all these bills and still have roughly $300 billion left over. Can you imagine what all those investments in our communities would do for our economy? Would lift millions of people out of poverty and provide them stability and make sure that your zip code is not dictating your ability to survive? I mean, these issues are paramount for our communities. And again, I said here in LA, we are ground zero for housing and homelessness. 1 in 5 single-family homes nationwide are being bought out by Wall Street private equity firms. Here in LA, over 2/3 of our residents are renters, and roughly 2/3 of all apartment complexes in LA are owned by private equity firms. And they are able to skyrocket prices, And here in LA, again, our minimum wage is $15, but because cost of living is so high, you got to be making $31 an hour to be able to afford to pay rent. So again and again, people are falling through the cracks. They are falling through these gaping holes in our social safety net. Can we imagine how much different that would be if we had a guaranteed income? If we had living wages that actually matched regional cost of living and were adjusted for inflation? If we had housing as an inherent human right and we were investing in social and public social housing across the entire country, in single payer Medicare for all, we could save $450 billion annually by enacting Medicare for all, and make sure that we're not having over 60,000 people die per year just because of lack of healthcare coverage in the wealthiest nation in the history of the world. So for me, once we're elected, my getting the ball rolling right out of the gate is focusing on divesting from the U.S. war machine and redirecting those funds back into our communities, back into living wages, back into basic income, back into clean air and water, healthcare and housing, and all the kitchen table issues that are at the forefront of the minds of our community members. We should not be financing endless wars. We should not be financing nation building. We should not be financing U.S. imperialism and militarism abroad. We should be taking care of our communities. That's what our campaign's all about.
Shervin, actually, that ties into a question from one of our viewers, Jeremy, who was curious about your take on Afghanistan today. I was looking this up. I think we're about $1 trillion in terms of U.S. spending.
Billion.
Yeah,
just in Afghanistan.
And you wonder, like, wow, what could we have done with that money here in America?
Exactly.
But what do you think about? I mean, Afghanistan now seems to be imploding in front of our eyes. I mean, after 20 years of what we thought was standing up a modern Afghani military, it is falling apart day by day. What do we do if the Taliban takes over and starts imposing very restrictive laws on women and girls, and maybe invites the Al-Qaeda elements back in? Like, how would you think about balancing the need for international security, but also being pragmatic?
Yeah, that's a fantastic question. And we have already seen the Taliban retake control of Afghanistan. Just this morning, they were outside of the city limits of Kabul. And what I saw recently is that President Ghani has already fled from the country. And we are already seeing the horror of the Taliban in kidnapping and raping women and girls. The brutality is back. But I think at the end of the day, what these last 20 years have demonstrated is the futility of the United States government being in the business of nation building. As tough of a pill as it may be to swallow, this is not our job. This is not our job. We maintain national security by investing in human rights, by investing in diplomacy, by investing in raising the public health and welfare of other nations. But unfortunately, our mission in Afghanistan was never about human rights. Our mission in Afghanistan was about establishing a pro-American counter-terrorist government in Afghanistan. And, when you're occupying a foreign country for 20 years with your military, as you're continuing to bomb the country and maintain a stranglehold over the economy, we did not go into Afghanistan under the guise of raising the welfare of the Afghani people. That's what we sold to the American citizens, but that's not what we did on the ground. 20 years, $825 billion expended, nearly 40,000 Afghani civilians dead, and over 2,300 American troops dead. What did we gain? Why did we not learn that lesson from Vietnam? Again and again, we are proving how U.S. imperialism does not lead to benefit. It does not lead to beneficial outcomes for any parties involved. It destabilizes the region. It provides further fodder to the most hardline right-wing conservative groups. And it demonstrates that U.S. militarism and imperialism is not how we actually improve the welfare of foreign countries. We need to invest in diplomacy. But the incumbent here, Brad Sherman, he was one of only 19 corporate Democrats to vote against the Iran deal, to vote against diplomacy back in 2015. And he still touts that to this day. And I talked about how my family are asylum seekers. Well, we fled religious persecution in Iran only about 25 years after our government here, the U.S. government, deposed the only democratically elected leader in Iranian history. So again and again, we recognize that America engaging in these acts of imperialism, destroying nations to implant governments that may very well be privy to corporate interests abroad and American corporate interests, but are not operating in the best interest of the nations and the peoples there. We need to be empowering the people in those countries, but that's not what we did. We engaged in military occupation and destabilization under this perpetual investment in counterterrorism abroad. It has not really seen any improvements in the safety of Americans here at home. While the American people suffer from food insecurity, while the American people suffer from homelessness, from lack of healthcare coverage, we have over 140 billion in medical debt in our country. To your point, Tom, let's take those dollars and invest them in our own backyards. Take care of our own people, as opposed to barreling down this road of endless wars and destabilization abroad.
Well, Shervin, this has been a great convo so far. I have some more questions for you, and we'll be inviting some more from the audience in a minute. But before we do that, I need to do a quick channel member shout out break to appreciate some of the people who make this podcast possible. So just bear with me while I thank some of our fellow nerds.
Sounds good.
And right here, we're going to start out with our senior VP, Soldier One. Thank you, Soldier One, for all your support. Next level down is our vice presidents, Kristen, Laura, Patrick, Richard, and Bike. And then we have our hardcore level, Mike, Gene, David, DK, Phoenix, Jekalago, Kirsch, Mr. History, Byron, Mona, Susan, Yang, Tony, Robert, Dean, Stat Nerd, Galessa, Jay Perrin, AJ, Vivian, Dana, Flavio, Yoda, Jason, and Parth. And then at our verified level, thank you to V, Helen, Lisa, Sugar, Albert, Brandon, Brian, Peter, Arez, Your Maman, Sophia, Jedwiga, Shake, Mike, Doris, Emerald, Lori, Ben, Roger, Lisa, Christina, Vaughn, Rasta, Jessica, Elizabeth, James, Emma, Hui, Ira, Shoni, Philip, Jameson, Dr. A, William, Karen, Monica, Mai, Ardent, Semery, David, Brittany, Sasha, Juana, Warren, Reddy, Lucky, and Kevin. Woo! Thank you to all the nerds who make this channel possible. They pay for our hosting costs and software for streaming, so appreciate that. One thing I want to talk with you, Shervin, before we wrap up, is being in the LA area, there's been a real challenge getting COVID under control.
Yeah,
it's not just Florida and Missouri and Louisiana. I mean, they definitely have their issues. I was curious, what's it like on the ground over there? I'm coming to you from Northern California. We've had been okay, doing pretty well so far. But, looking at these numbers across the country, it's kind of crazy. And I was curious what your thoughts are.
Yeah, no, it's really, really concerning what we're seeing, where, as we've seen again and again, the folks who are being disproportionately impacted by the new Delta variant are unvaccinated. That's why, again, it is so important. Please get your vaccine. For our neighbors, for our communities, for our ability to get back to a sense of normalcy. Please, please, please get vaccinated. It protects you. It protects your family members. It gets us back on track. But unfortunately, there's been just so much disinformation over the past year, and so much lack of trust in our public health system. In my lifetime as a public health activist, I have never seen public health politicized to the extent it is today around just basic mask wearing. And it's ludicrous that we're in this position now, because again, if we just take the time, at the very beginning, we took the time to really educate our communities and provide those transparent, honest discussions about what the problem is, how we keep our communities safe, I wonder if we would be in the position we are today. But now, some of the last things I heard is that rates are as bad as they were back in the winter. Yet there's really no political will to go back into a lockdown. Even though some of our public health experts may quietly be saying that's what we may need to do to get a rein on this Delta variant. But no, it's extremely concerning. And again, what we're seeing is that our low-income neighbors and our unhoused neighbors are being disproportionately impacted. While vaccination rates here in LA, I believe, hover around 60% for the general population, among our unhoused, it's around 20%. Even though death rates among our unhoused from COVID are roughly 50% higher than the general population, according to a UCLA study released late last year. And while we saw the governor now require healthcare workers to be vaccinated before going back into the office, we're not seeing that same pressure on police departments, even though only about a third of LAPD are vaccinated, even less than that for the sheriff's department. So again, and these are people that are going out in their communities every single day and refusing. Our sheriff here said he's not going to enforce the mask mandate. I mean, it's bonkers, the situation that we're in. It's really, really scary. And we're not really seeing any accountability on LAPD and the sheriff's department to protect our communities. And it's despicable. So all of this is really, really concerning. And we need to see those investments, especially with our schools as well. One of my close friends, she's a teacher here at El Camino High School, which is my high school here in the Valley. And there have already been several cases. She's like, kids are standing in line for hours to get tested and screened before entering the classroom. And she's like, I don't know if we're going to stay in person for much longer. We're probably going to go back to virtual. A couple of my cousins here who are in high school, they're like, yeah, I don't know what's going to happen. I think we're going to go back to virtual. They're now in their junior and senior years. So it's really, really concerning. We are not making the necessary investments in our teachers, our administrators, our students and families to make sure that we are protecting all of our community members. So there's a lot that needs to be, that's on the forefront of our minds around this. COVID has not gone away. We need to take this pandemic seriously. We are still in a pandemic, folks. So please, please, please get vaccinated.
Yeah, it is definitely concerning with the new Delta showing lots of younger people showing up in hospitals. I have some friends that work in healthcare in different hospitals, and they're saying that the unvaccinated are just pouring in to these hospitals, and they're actually now in positions where they have to defer other patients from getting treatment because they just need to increase more COVID wards. And so it affects the vaccinated who might just need other types of procedures because they're getting pushed out to make room for the unvaccinated that are just pouring in every day. And so it affects, like, when people say, it's my choice, it's like, well, but you're part of a shared healthcare resource, you know?
Right.
And you may want to take these risks for yourself. And, it's a free country. But when it then impacts other people who had no choice, they weren't part of your decision. And now their care is being affected. We obviously all pay into Medicare and private insurance. It's a pooled resource. The risk is pooled. Like it's not like everybody just pays for their own healthcare bills
Right.
out of their pocket.
Right.
Yeah, and it's also, I think it's worth talking about that it's not just, of course, you've got these kind of radical Trump people, but then you do have like minority groups that are pretty low in getting vaccinated. And
If I could jump in on that,
yeah.
I mean, I think one that demonstrates the institutional racism within our healthcare system, but it also harkens back to the sordid history of human rights abuses and violations in research studies within Black and Indigenous and Latinx communities. I mean, everything from the Tuskegee study to the fact that up until the 1970s, the Federal Indian Health Service was sterilizing Native women. These are still at the forefront of the minds of our communities of color. And we have not done enough to invest in healing from those past injustices and making our communities whole. And you talked about how, our hospitals are lacking capacity for everyday healthcare emergencies, from traffic accidents to physical altercations to any kind of ailment that puts you in the emergency ward. It again demonstrates the crumbling nature of our public health infrastructure. Think about this. During this pandemic, during the early days, our doctors and nurses were sporting trash bags as opposed to PPE in the wealthiest country in the world. And I think what's so important about this is that we never actually restocked the national strategic stockpile after H1N1. And when I was working on Capitol Hill, Congress was working on one of the foundational laws for public health infrastructure called the Pandemic All Hazards Preparedness Act, PAPA. This law expired in 2014. This is a law that invests in everything from our disease surveillance efforts to building capacity and mitigation and response efforts for public health outbreaks within our communities, to being able to restock our national stockpile of medicines, vaccines, PPE, etc. Congress did not reauthorize this bill until the end of 2019. They let it expire for years. And remember, our group was one of the groups on Capitol Hill clamoring down the doors of senators and members of Congress saying, you got to get this done. You got to get this bill reauthorized. We pump the money into the economy to get us ready for the next public health emergency. But again and again, we saw this inability to really prioritize our community and be proactive about the necessary laws we need in place to protect our communities. So that's one thing that I'm really passionate about, is going in. And again, I hadn't talked about this yet, but in the decade leading up to the COVID-19 pandemic, our legislators halved the budget of the CDC between 2010 and 2020. Think about that for a second. If we had a fully funded and functional CDC, would this pandemic have been as impactful as it is today? I think not. I think we'd have been able to actually mobilize our community and protect our communities in a much more effective manner had we invested in a fully funded CDC. But as we saw public health funding drop, every single year, our funding for the military increased and increased and increased to now $740 billion enacted for fiscal year 2021. Again, budgets reflect priorities. Again and again, we are shown that this is the one truism in our national politics.
Shervin, it's been a pleasure having you in the Nerd Zone.
Thank you so much.
Before we wrap up, are there any final remarks or calls to action for the audience? It's been really great to get to know you.
Yeah, likewise. Thank you so much again, Tom. Our campaign is focused on building a new political coalition of young people, immigrants, people of color who are sick and tired of the status quo and want to see structural changes enacted at the federal level. From healthcare as a human right to housing as a human right, living wages, basic income, climate justice, and everything in between. I am proud to say that our campaign has the endorsement of brand new Congress nationally, the endorsement of Marianne Williamson. We have the endorsement of the Feel the Burn Democratic Club locally, of the West Valley People's Alliance, which leads the largest homeless outreach network in the entire San Fernando Valley. I'm also very proud to say that we have over 150 volunteers signed up, over 70% of whom live in our district and are under the age of 30. So it's just been incredible to see how our young people are mobilized and saying enough is enough. We deserve a real progressive advocate fighting for us on Capitol Hill. So please get involved, volunteer, donate to our People First campaign. Our campaign proudly accepts zero corporate PAC money. We've taken in the fossil fuel money pledge, the Code Pink pledge to divest from the U.S. war machine, the Patience Over Profits pledge. We are 100% financed by our community members. And you can get involved at shervinforthevalley.com. Sign up to volunteer, follow us on social media, donate to our campaign if you can, and let's do this. Let's get a real progressive elected. Let's oust the corporate Democrat and fight for our communities at the national level for the bold structural reforms we know we could achieve if we had real progressive advocates.
Well, thanks again, Shervin. I hope people will check you out, and they should vote to approve you on Of the People so that you'll be a trending candidate there. With that, we're going to say goodbye, nerds.
Goodbye, nerds. Thank you, Tom. Thank you to your viewers. Take care, everybody.
Love it.